it is difficult. If you have gastric cancer, even though it's a bad prognosis, and if you have peritoneal metastasis, it's even worse. So they actually have no real treatment because they come under the roof of metastatic gastric cancer. And nobody is looking whether these are liver metastases, lung metastases, or peritoneal metastases. They just come under the roof. And now, being a surgeon, I have a lot of possibilities to get access to the abdominal cavity and to see whether there is peritoneal metastasis or not. Therefore, at the moment in all guidelines, before you start to treat the patients with gastric cancer, you will have to have a laparoscopy. And due to the laparoscopy, you can define whether this is already a peritoneal metastatic disease or not. And you have to realize that especially patients with distal gastric cancer and locally advanced, 40% have peritoneal metastasis. So they are treated then for palliative situation because oncologists think that there is no treatment rather than systemic chemotherapy. And there is a lot. We have to realize that at the moment, medical oncologists have no real information how to treat patients with solitary peritoneal metastasis. There is no trial, nothing exists. And therefore, it is really important to give them information about what is possible with cytoreductive surgery and HIPEC, so intraperitoneal heated chemotherapy, not in the normal way with systemic treatment, but also locally on the top of the tumor, which is then perhaps really helpful. We have the gastric GASTRIPEC trial. We have some randomized trials. There's one bad one, which really is the Renaissance trial. It does not deliver any information about this topic, but this is what we have to realize. There is the possibility to give intraperitoneal chemotherapy in several kind of ways. We have the HIPEC, we have the PPAC, we have intraperitoneal chemotherapy via port system. So there's a lot to do, but at the moment we stick to randomized trials, which is really difficult because these patients are supported to be palliative, oncological patients, and we have no access. So we will never get real good information for this. There is a randomized trial done in Asia, the Dragon style trial, and they could demonstrate that they have significant better results if you have intraperitoneal chemotherapy in these patients. So we have to get a new situation for these patients. First of all, we have to realize that there's peritoneal metastasis only. Second, we have to get them other kind of treatments, not only systemic treatment, but also combined with intraperitoneal treatment. So I think then the patient have new possibilities and other future.